Now let's talk about the procedure itself. Okay, when you come to my office, I want you to know exactly what's going to happen, so nothing takes you off guard. When you enter the office, what we do first is we put numbing cream on the area. Okay, and it sits there for about an hour. Okay, the numbing cream does 95% of the numbing. Okay, that's why we want that, because that's the easiest way to do it and the most comfortable way. Then the next step is I take a small needle and I poke the penile skin superficially. That's my entrance point or portal. You don't feel that, of course, you're numb at that point. Then what I do is I take a cannula, which obviously it's not this big. It looks like a needle actually, but has a blunt tip, so it's not sharp. So what I do is I enter into that little needle port, that little needle poke here. I enter in and I fill the entire shaft. And I go and fill this way, and I fill this way, and I fill this way through that one needle poke. Okay, then I will massage a little bit, make sure everything's in balance. Then we put a bandage on, just like this, and you walk out with this. Okay, that is it. Now, this takes about 2 to 3 hours, right? But those who are flying in, just a note, most of my patients do fly into Miami or New York, because I have 2 offices. I want you to allow 5 hours, because sometimes we allow more anesthesia time, sometimes there's a little delay, and I don't rush. So if you're coming in at an 8 o'clock appointment, expect to leave around 1 o'clock so you could schedule accordingly. Okay, so just to mention, I do have a Miami office, I have a New York office. When it comes to financing and fees and specials, go on my finance page on the website. Okay, that is all the information you need. If you need any additional information, you call my office and my secretaries will take care of you. All right. All right, so let's go back to our procedure. So you know exactly what happens with the topical, with the little needle poke, with the insertion of the filler, and the distribution along the whole shaft. And this is what the bandage will look like when you leave the office. Okay, and you'll learn how to put this on. Okay, we're going to give you a DVD. It's also going to be posted on the internet, on the website, on how to rewrap yourself. Okay, so everything is there. We give you supplies that you need, so you're covered. Now, post-procedure care, let's talk about that briefly. Because remember I told you that committing is important and spending an hour a day is going to happen. You have to spend that hour a day. Okay, and what you're going to do is, let's say you're ready to, let's say today you had it done, fine, here you look like this. Now it's the next day, you might want to take a shower. And if you don't want to change your wrap, you can put a condom on just to cover. But if you're ready to change your wrap, and you can, what you'll do is basically change out the top part and leave the constrictive bands on, because you always have to have these on. You could take all the top off, take a shower, and then when you're about to put a new wrap on, then you could take the constrictive elements off and start fresh. Okay, and that's what you'll do every day. I would want you to take an Epsom salt bath for 45 minutes, a hot Epsom salt bath for 45 minutes every other day. Very good for the skin and skin healing. I think indirectly it helps collagen formation. Okay, you'll be sending me photos every day, because I need to see what's happening here. So every day you're going to take a top view photo, underside view photo, and you're going to comment on how you feel. Okay, like for example, why do we want these photos? Let me tell you why. I want to see the integrity of the bandage. I want to see if it's done correctly. I want to see the health of the skin. Okay, I look at if there's any discoloration of the bandage and so forth. Okay, there are reasons. And if, let's say, there's an imbalance, let's say there's some fluid accumulating under here and there's a little bulge here. Okay, and that's common because the skin over here is very thin. What I'll do is tell you, hey, just do some finger pressure, okay, or finger rolling motions to move the fluid out. Consider it like wet plaster under there. So as it's starting to harden, we want to make sure it shapes properly, and my eyes and your eyes need to be on it together so I can guide you on what to do. Okay, very important. Now, that's enough of the post-operative care, instructions, and so forth. That's all covered on another video. I just wanted to give you an introduction to this because it's very important. Again, this is teamwork. This is more of an art than a science, and we need to participate and work together.